Question 1. Strategic planning requires a certified addictions treatment counselor, CAC, to consider how to best serve clients with emerging therapeutic approaches. A CAC has recently encountered a promising new therapeutic technique in a preliminary research paper that aligns with their personal clinical intuition for treating a specific client's complex addiction profile. However, this technique is not yet widely recognized or extensively validated by peer-reviewed literature within the established addiction treatment field. What is the most ethically and professionally sound approach for the CAC to integrate this technique into their practice for this client? Option A. Conduct a thorough literature review of the technique, consult with supervisors and experienced colleagues, and engage in a detailed, informed consent process with the client, clearly outlining the research status, potential benefits, and risks before considering its implementation. Option B. Dismiss the technique entirely due to its lack of widespread validation and continue with standard, evidence-based treatments that are well established. Option C. Immediately implement the new technique with the client, trusting their clinical intuition and the preliminary research, as delaying treatment could be detrimental. Option D. Encourage the client to seek out practitioners who are already using this new technique, as the CAC is not yet qualified to offer it. Correct answer is A. Conduct a thorough literature review of the technique, consult with supervisors and experienced colleagues, and engage in a detailed, informed consent process with the client, clearly outlining the research status, potential benefits, and risks before considering its implementation. Explanation. This scenario presents a common ethical dilemma for certified addictions treatment counselors, CAC, in California, where the integration of research into clinical practice is paramount, but must be balanced with client welfare and professional boundaries. The challenge lies in the counselor's personal experience with a particular therapeutic modality that, while promising, may not yet be widely supported by robust, peer-reviewed research applicable to the specific client population. The counselor must navigate the ethical imperative to provide evidence-based care, while also acknowledging the potential benefits of innovative approaches and respecting client autonomy. The correct approach prioritizes the client's well-being and adheres to established ethical and regulatory standards for CAC in California. This involves a thorough review of existing research, consultation with supervisors and peers, and transparent communication with the client about the evidence base and potential risks and benefits. This approach aligns with the California Code of Regulations, Title 9, Division 4, Chapter 1, Article 1, which emphasizes the counselor's responsibility to provide competent services and to stay current with professional knowledge and skills. Specifically, the counselor must ensure that any intervention, even one based on emerging research, is delivered within the scope of their practice and with appropriate informed consent. The ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, are central here. An incorrect approach would be to unilaterally implement the unproven modality without adequate research validation or consultation. This could violate the counselor's duty to provide evidence-based treatment, potentially exposing the client to ineffective or even harmful interventions. Such an action could be seen as a breach of professional competence and a failure to uphold the standards set forth by the California Association of Alcohol and Drug Abuse Counselors, CATC, Code of Ethics, which guides CAC practice. Furthermore, failing to consult with supervisors or colleagues represents a departure from best practices in professional development and risk management, potentially leading to ethical violations related to supervision and peer review. Another incorrect approach would be to dismiss the modality entirely due to a lack of widespread acceptance, thereby potentially denying the client access to a beneficial treatment. This would fail to embrace the spirit of integrating emerging research and could be seen as a lack of professional curiosity and a disservice to the client if the modality does indeed hold promise. This approach neglects the principle of exploring all potentially beneficial avenues of treatment within ethical and professional boundaries. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the ethical issue, the conflict between personal belief in an unproven modality and the requirement for evidence-based practice. 2. Gather information. Thoroughly research the modality, its theoretical underpinnings, any existing studies, even preliminary ones, and its applicability to the client's specific condition. 3. Consult relevant ethical codes and regulations. Review the CATC Code of Ethics and California Code of Regulations for guidance on evidence-based practice, informed consent, and professional competence. 4. Seek supervision and peer consultation. Discuss the situation with a supervisor and/or experienced colleagues to gain different perspectives and ensure adherence to best practices. 5. Evaluate risks and benefits. Weigh the potential benefits of the modality against the potential risks, considering the client's individual needs and circumstances. 6. Informed consent. If proceeding with the modality, ensure the client fully understands the research status, potential benefits, risks, and alternatives, and provides explicit informed consent. 7. Document thoroughly. Maintain detailed records of the decision-making process, consultations, and informed consent discussions. Question 2. Which approach would be most effective for a CATC counselor when a client presents with a diagnosed anxiety disorder and a recent history of alcohol dependence, considering the need for integrated treatment and adherence to professional ethical standards? Option A. Develop a treatment plan that simultaneously addresses both the anxiety disorder and the alcohol dependence, coordinating care with the client's psychiatrist. Option B. Focus solely on treating the alcohol dependence, as it is the primary reason for seeking addiction counseling services. Option C. Recommend separate treatment providers for the anxiety disorder and the alcohol dependence, with no direct coordination between them. Option D. Prioritize treatment of the anxiety disorder, assuming that resolving this will alleviate the substance use issues. The correct answer is A. Develop a treatment plan that simultaneously addresses both the anxiety disorder and the alcohol dependence, coordinating care with the client's psychiatrist. Explanation. This scenario presents a common challenge for certified addictions treatment counselors, CATC, when working with clients who have co-occurring disorders. The professional challenge lies in accurately assessing and addressing the complex interplay between mental health conditions and substance use disorders, ensuring that treatment is integrated and effective. Careful judgment is required to avoid misdiagnosis, inadequate treatment, or the exacerbation of one condition while treating the other. The regulatory framework for CATC emphasizes a holistic and client-centered approach, requiring counselors to possess a broad understanding of various theoretical perspectives to tailor interventions effectively. The correct approach represents best professional practice because it acknowledges the biopsychosocial model, which is foundational in addiction treatment, and aligns with the ethical guidelines for CATC. This model posits that addiction is influenced by biological, psychological, and social factors. Integrating a client's mental health diagnosis with their substance use disorder treatment, as advocated by the correct approach, ensures that all aspects of the client's well-being are considered. This aligns with the CATC responsibility to provide comprehensive care and to advocate for the client's needs within the healthcare system, often requiring collaboration with other mental health professionals. Ethical guidelines mandate that counselors practice within their scope of competence and seek appropriate consultation or referral when necessary, which is inherent in an integrated approach. An incorrect approach that focuses solely on the addiction without considering the underlying mental health condition fails to meet the comprehensive care standards expected of a CATC. This could lead to treatment that is ineffective or even detrimental, as the mental health symptoms may worsen or manifest in ways that interfere with addiction recovery. Ethically, this approach could be seen as a failure to provide adequate care and a potential violation of the duty to promote client well-being. Another incorrect approach that prioritizes the mental health condition over the substance use disorder also presents significant ethical and regulatory concerns. Addiction is a primary disease, and neglecting its treatment while focusing on other mental health issues can lead to relapse, continued harm from substance use, and a failure to address the core problem. This demonstrates a lack of understanding of the interconnectedness of these conditions and a deviation from best practices in addiction counseling. A third incorrect approach that suggests treating each condition in isolation, without coordination, is also professionally unsound. This fragmented approach can lead to conflicting treatment plans, poor communication between providers, and a lack of continuity of care, all of which negatively impact client outcomes. It fails to recognize the synergistic nature of co-occurring disorders and the importance of integrated treatment, a key principle in modern addiction counseling. The professional decision-making process for similar situations should involve a thorough assessment that identifies all presenting problems, including both substance use and mental health concerns. Counselors should then consult relevant theoretical frameworks, such as the biopsychosocial model, to understand the interplay of these issues. Collaboration with other healthcare professionals, adherence to ethical codes, and a commitment to ongoing professional development are crucial for providing effective and integrated care. Question 3. The review process indicates a counselor has utilized a single, widely recognized standardized assessment instrument to diagnose a client with a complex co-occurring disorder, without considering the instrument's limitations for such cases or supplementing it with other assessment methods. Which of the following actions best reflects appropriate professional practice in this situation? Option A. Discontinuing the use of standardized assessment instruments altogether, relying solely on subjective clinical judgment for future assessments. Option B. Proceeding with the initial diagnosis and treatment plan, assuming the chosen instrument is sufficient for all diagnostic purposes. Option C. Conducting a more comprehensive assessment using multiple, complementary standardized instruments and clinical interviews to gather a broader range of data. Option D. Re-administering the same instrument with a different scoring interpretation to align with the initial diagnostic impression. The correct answer is D. Re-administering the same instrument with a different scoring interpretation to align with the initial diagnostic impression. Explanation. The review process indicates a need to assess the appropriate use of standardized assessment instruments in a clinical setting. This scenario is professionally challenging because the counselor must balance the efficiency and objectivity of standardized tools with the nuanced, individual needs of a client. Over-reliance on a single instrument can lead to misdiagnosis or incomplete understanding, while neglecting standardized tools can compromise diagnostic accuracy and evidence-based practice. Careful judgment is required to select, administer, and interpret these instruments ethically and effectively within the CATC framework. The correct approach represents best professional practice because it emphasizes a comprehensive and individualized assessment, utilizing multiple, appropriate standardized instruments, considering client-specific factors, and integrating findings with clinical observation, aligns with ethical guidelines and regulatory requirements for accurate diagnosis and treatment planning. This approach ensures that the assessment is both reliable and valid, providing a solid foundation for effective intervention. An incorrect approach that relies solely on a single, potentially inappropriate standardized instrument fails to meet the ethical obligation of providing a thorough assessment. This can lead to misdiagnosis, inappropriate treatment, and potential harm to the client, violating principles of beneficence and non-maleficence. Furthermore, it may contraindicate specific CATC regulations that mandate comprehensive client evaluation. Another incorrect approach that disregards standardized instruments in favor of purely subjective clinical judgment risks diagnostic bias and lacks the objective data required for evidence-based practice. This can lead to inconsistent treatment approaches and may not meet the standards for documentation and accountability expected within the regulatory framework. A further incorrect approach that prioritizes speed over accuracy in administering and interpreting standardized instruments compromises the integrity of the assessment process. This can result in inaccurate data, flawed treatment plans, and potential ethical breaches related to professional competence and due diligence. The professional reasoning process for similar situations should involve a systematic evaluation of the client's presenting issues, the purpose of the assessment, and the availability of validated instruments. Counselors should consult relevant literature and professional guidelines to select instruments that are culturally sensitive, appropriate for the client's demographic, and have demonstrated reliability and validity for the intended purpose. The interpretation of results must always be contextualized within the client's unique circumstances and integrated with other sources of information, including clinical interviews and collateral information, to form a holistic understanding. Question 4. The analysis reveals that a client presents with persistent cravings and withdrawal symptoms despite significant periods of abstinence, suggesting a complex interplay of neurobiological factors. As a CATC, how should you best integrate this understanding of neurobiological mechanisms into your treatment planning and client education? Option A. Develop a treatment plan that incorporates psychoeducation on the brain's reward pathways and how addiction alters them, alongside behavioral strategies to manage cravings, and discuss these concepts with the client in an accessible manner to foster understanding and adherence. Option B. Focus exclusively on the client's reported behavioral triggers and coping mechanisms, as neurobiological explanations are too complex for clients to grasp and may not directly influence immediate behavioral change. Option C. Attribute the client's ongoing struggles primarily to a lack of willpower and moral fortitude, advising them to simply try harder to resist cravings. Option D. Provide the client with raw scientific journal articles detailing the specific neurotransmitter imbalances and receptor changes associated with their substance use, encouraging them to interpret the data themselves. Correct answer is A. Develop a treatment plan that incorporates psychoeducation on the brain's reward pathways and how addiction alters them, alongside behavioral strategies to manage cravings, and discuss these concepts with the client in an accessible manner to foster understanding and adherence. Explanation. The analysis reveals a scenario where a certified addictions treatment counselor, CATC, must interpret complex neurobiological findings to inform treatment planning. This is professionally challenging because it requires translating scientific research into practical, ethical, and effective client care, while adhering to strict professional standards and client confidentiality. The counselor must balance the need for evidence-based practice with the individual needs and circumstances of the client. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the client's individual neurobiological profile in conjunction with their psychosocial history. This aligns with the CATC ethical obligation to provide individualized care, grounded in current scientific understanding, and to advocate for the client's well-being. It emphasizes a collaborative approach with the client, ensuring informed consent and shared decision-making regarding treatment, which is a cornerstone of ethical addiction counseling. This approach respects the client's autonomy and promotes engagement in treatment by demystifying the biological underpinnings of their addiction. An incorrect approach that focuses solely on the client's self-reported symptoms, without considering the underlying neurobiological mechanisms, would fail to provide a complete picture for effective treatment. This could lead to a superficial understanding of the addiction, potentially resulting in less targeted and less effective interventions. It might also inadvertently pathologize the client's experience without offering a scientifically informed perspective on the brain's role in addiction. Another incorrect approach that involves sharing detailed neurobiological research findings with the client without proper context or simplification would be professionally unsound. This could overwhelm the client, lead to misinterpretation, and potentially cause distress or anxiety. It also risks violating client confidentiality if the information is not handled with extreme care and within the bounds of the therapeutic relationship. Furthermore, it bypasses the counselor's role in synthesizing complex information into actionable insights for the client. A third incorrect approach that dismisses the relevance of neurobiological mechanisms entirely. Attributing addiction solely to willpower or moral failing is ethically and scientifically indefensible. This stance is not only outdated but actively harmful, perpetuating stigma and hindering effective treatment. It directly contradicts the evidence-based understanding of addiction as a complex brain disorder and would violate professional standards that mandate the use of current scientific knowledge in treatment. The professional decision-making process for similar situations should involve a systematic evaluation of available information, including client history, presenting issues, and relevant scientific literature. Counselors must critically assess how neurobiological findings can inform, but not dictate, treatment. This involves integrating this knowledge with psychosocial factors, client preferences, and ethical considerations. The process should always prioritize client well-being, autonomy, and confidentiality, ensuring that all interventions are evidence-based, culturally sensitive, and tailored to the individual's unique needs. Question 5. The assessment process reveals that a client who has a history of violent behavior expresses a specific and credible threat to harm a former romantic partner. The counselor is aware of the partner's identity and location. What is the most ethically and legally sound course of action for the Certified Addictions Treatment Counselor, CATC, in this jurisdiction? Option A. Immediately contact the former romantic partner and law enforcement to report the threat, without further consultation. Option B. Document the threat thoroughly, consult with a supervisor and/or legal counsel to determine the specific legal obligations and ethical guidelines for breaking confidentiality in this jurisdiction, and then act accordingly to ensure safety. Option C. Discuss the client's threat with other counselors in the agency who are not directly involved in the client's treatment to seek their opinions on how to proceed. Option D. Advise the client that they cannot continue treatment if they continue to express such threats, but take no further action regarding the threat itself. The correct answer is A. Immediately contact the former romantic partner and law enforcement to report the threat, without further consultation. Explanation. The assessment process reveals a common yet complex ethical and legal challenge for addiction counselors, balancing client confidentiality with the duty to warn or protect when a client expresses intent to harm another. This scenario is professionally challenging because it pits two fundamental ethical principles against each other: the client's right to privacy and the counselor's responsibility to prevent harm. Navigating this requires careful judgment, adherence to specific legal mandates, and a thorough understanding of professional ethical codes. The correct approach represents best professional practice because it prioritizes a structured, legally compliant, and ethically sound response. This involves consulting with supervisors and legal counsel to ensure all actions align with the specific requirements of the governing jurisdiction's laws, e.g., tariff duty, if applicable, and state-specific reporting laws, and professional ethical standards, e.g., those outlined by relevant professional bodies for CATC certification. This approach ensures that the client's rights are respected as much as possible, while fulfilling the paramount duty to protect potential victims. It also involves documenting all steps taken and the rationale behind them, which is crucial for accountability and legal protection. An incorrect approach that involves immediately reporting the threat to law enforcement without further consultation or assessment is professionally unacceptable. This fails to consider the nuances of the client's statement, potentially violating confidentiality without sufficient legal justification. It bypasses the crucial step of assessing the imminence and seriousness of the threat, which is often a prerequisite for breaking confidentiality under duty to warn statutes. Another incorrect approach, such as ignoring the threat or downplaying its significance, represents a severe ethical and legal failure. This directly contravenes the counselor's duty to protect and could lead to tragic consequences, resulting in legal liability and professional sanctions. A third incorrect approach, which might involve discussing the client's threat with colleagues not directly involved in the case without proper authorization or a clear clinical rationale, also violates confidentiality and is ethically unsound. Professionals should employ a decision-making framework that begins with a thorough assessment of the threat's credibility, imminence, and the specific nature of the harm. This is followed by immediate consultation with supervisors, and if necessary, legal counsel to understand the specific legal obligations of the jurisdiction. The decision to breach confidentiality must be based on a clear and present danger, documented thoroughly, and executed in a manner that minimizes the breach while maximizing safety. Maintaining accurate and detailed records of all assessments, consultations, and actions taken is paramount. Question 6. Governance review demonstrates that a client who has successfully completed the primary phase of addiction treatment and is deemed clinically stable expresses a strong desire to be discharged immediately to return to their previous living situation, despite having limited social support and no concrete plan for ongoing recovery services. What is the most appropriate course of action for the treatment team to ensure continuity of care and facilitate a successful transition? Option A. Delay the client's discharge until a stable housing situation and a guaranteed long-term support network are firmly established, even if this extends their stay in the current treatment program beyond the initial clinical recommendation. Option B. Provide the client with a generic pamphlet of local support groups and encourage them to attend meetings as they deem fit, then proceed with discharge as per their request. Option C. Collaboratively develop a comprehensive aftercare plan with the client, identifying specific recovery support services, relapse prevention strategies, and a clear transition process, while addressing the client's immediate concerns and exploring options for interim support if necessary. Option D. Honor the client's request for immediate discharge to their previous living situation, providing them with a list of community resources and trusting their ability to seek out support independently. Correct answer is C. Collaboratively develop a comprehensive aftercare plan with the client, identifying specific recovery support services, relapse prevention strategies, and a clear transition process, while addressing the client's immediate concerns and exploring options for interim support if necessary. Explanation. This scenario presents a common challenge in addiction treatment, ensuring a seamless transition from intensive treatment to ongoing support, which is critical for sustained recovery. The professional challenge lies in balancing the client's immediate needs and preferences with the long-term requirements for recovery, while adhering to ethical and regulatory standards for discharge planning and continuity of care. Careful judgment is required to avoid premature discharge or inadequate aftercare, both of which can jeopardize the client's progress. The correct approach prioritizes a collaborative and client-centered process that aligns with the principles of evidence-based practice and regulatory mandates for continuity of care. This involves a thorough assessment of the client's post-treatment needs, engagement of the client and their support system in developing a realistic and actionable aftercare plan, and ensuring that the plan includes specific, measurable, achievable, relevant, and time-bound, SMART goals. This approach represents best professional practice because it respects client autonomy, promotes engagement, and directly addresses the regulatory requirement to facilitate a smooth transition to the least restrictive level of care necessary, thereby maximizing the likelihood of sustained recovery. It aligns with ethical obligations to provide comprehensive care and discharge planning that supports client well-being beyond the treatment episode. An incorrect approach that focuses solely on the client's stated desire to leave without a comprehensive aftercare plan fails to meet the regulatory requirement for discharge planning that ensures continuity of care. This is an ethical failure as it prioritizes immediate client request over their long-term well-being and recovery stability, potentially leading to relapse. Another incorrect approach that involves discharging the client with a generic list of resources without personalized support or follow-up neglects the individualized nature of addiction treatment and aftercare planning. This is a regulatory and ethical failure because it does not demonstrate a commitment to ensuring the client has the necessary support to maintain sobriety, potentially violating standards for effective discharge planning. A third incorrect approach that delays discharge until a perfect, long-term housing solution is secured, without considering interim support or the client's readiness to transition, can be detrimental. This is an ethical failure as it may unnecessarily prolong treatment beyond the client's immediate clinical need, potentially creating dependency and hindering their ability to engage with community-based support systems, and may also be a regulatory issue if it deviates from established discharge timelines without clinical justification. The professional decision-making process for similar situations should involve a systematic evaluation of the client's clinical status, their identified needs and strengths, and the available resources. This includes a thorough risk assessment for relapse and a collaborative development of an aftercare plan that is tailored to the individual. Professionals must consult relevant regulations and ethical codes to ensure that all discharge planning activities are compliant and client-centered, prioritizing the client's safety and long-term recovery success. Question 7. During the evaluation of a client presenting with severe methamphetamine addiction and expressing homicidal ideation towards a specific individual, what is the most ethically and legally sound course of action for a CAC? Option A. Document the client's statements and continue with the treatment plan, assuming the client will not act on their ideations and that confidentiality must be maintained at all costs. Option B. Advise the client that their statements about harming someone will be reported to the authorities, potentially jeopardizing the therapeutic alliance and encouraging the client to withhold further information. Option C. Immediately breach client confidentiality and report the threat to the individual and law enforcement, without consulting supervisors or legal counsel. Option D. Consult with a supervisor and/or legal counsel to assess the imminence and credibility of the threat, explore legal obligations regarding duty to warn/protect, and determine the appropriate course of action, ensuring thorough documentation of all steps taken. The correct answer is C. Immediately breach client confidentiality and report the threat to the individual and law enforcement without consulting supervisors or legal counsel. Explanation: this scenario presents a significant ethical challenge for a certified addictions treatment counselor, CAC, due to the inherent conflict between client confidentiality and the potential for harm to others. The CAC must balance their legal and ethical obligations to protect client privacy with their duty to prevent foreseeable harm. This requires careful consideration of the specific circumstances, the nature of the threat, and the applicable regulations governing such situations. The correct approach prioritizes a systematic, informed, and legally compliant process. It involves consulting with supervisors and legal counsel to ensure all actions taken are within the bounds of professional ethics and state law. This collaborative approach allows for a thorough assessment of the situation, exploration of all available options, and the implementation of the least restrictive intervention necessary to mitigate the risk. This aligns with the CATC Code of Ethics, which emphasizes client welfare, professional competence, and adherence to legal standards. Specifically, it addresses the duty to warn or protect when a client poses a serious danger of violence to another identifiable person, as often stipulated in state statutes and professional ethical codes. An incorrect approach would be to immediately breach confidentiality without proper consultation or assessment. This could violate client privacy rights and potentially damage the therapeutic relationship, hindering future treatment. Another incorrect approach is to do nothing, assuming the threat is not serious or that the responsibility lies solely with the client. This failure to act when there is a foreseeable risk of harm to others is a serious ethical and legal breach, potentially exposing the counselor and the agency to liability. Failing to document the situation and the decision-making process is also a critical error, as it leaves the counselor without a record of their professional judgment and actions, which is essential for accountability and review. Professionals should approach such dilemmas by first recognizing the potential conflict. They should then gather all relevant information, consult with supervisors and legal counsel, explore all ethical and legal options, document their decision-making process thoroughly, and implement the chosen course of action in a manner that minimizes harm while respecting client rights to the greatest extent possible. Question 8. The evaluation methodology shows a counselor attempting to screen a client for a potential substance use disorder. The counselor is considering several approaches to gather initial information. Which of the following methodologies best aligns with the CATC regulatory framework for initial screening of substance use disorders, ensuring a foundation for appropriate treatment planning? Option A. Administering a widely recognized, validated screening instrument designed for general substance use, considering the client's reported symptoms and demographic information. Option B. Utilizing a self-designed questionnaire that covers general health questions but lacks specific validated items for substance use screening. Option C. Relying primarily on the counselor's clinical intuition and anecdotal observations of the client's behavior during the initial session. Option D. Focusing exclusively on screening for a single, commonly abused substance based on the counselor's initial impression, without exploring other potential substance involvement. The correct answer is A. Administering a widely recognized, validated screening instrument designed for general substance use, considering the client's reported symptoms and demographic information. Explanation. This scenario presents a common challenge in addiction counseling, selecting the most appropriate screening tool for a client presenting with potential substance use disorder (SUD) symptoms. The challenge lies in balancing the need for efficient assessment with the ethical and regulatory imperative to utilize validated instruments that accurately identify the severity and nature of the SUD. Professional judgment is required to ensure the chosen tool aligns with the client's presenting issues, cultural background, and the specific requirements of the treatment setting, all while adhering to the CATC regulatory framework. The correct approach represents best professional practice because it prioritizes the use of a standardized, evidence-based screening tool that is recognized within the field and appropriate for the client's demographic and presenting concerns. This aligns with CATC guidelines that emphasize the importance of using validated assessment instruments to ensure accurate diagnosis and appropriate treatment planning. Utilizing a tool with established psychometric properties contributes to reliable and valid screening, which is crucial for effective intervention and client care. An incorrect approach that relies solely on informal observation or a non-validated self-report questionnaire fails to meet regulatory and ethical standards. Informal observation, while part of the overall assessment, is subjective and lacks the systematic structure and psychometric validation required for a formal screening. Using a non-validated tool introduces significant risk of inaccurate assessment, potentially leading to under- or overdiagnosis, inappropriate treatment recommendations, and a failure to meet the client's needs. This violates the CATC mandate for competent and ethical practice, which necessitates the use of tools that have demonstrated reliability and validity in identifying SUDs. Another incorrect approach that focuses exclusively on a single substance without considering polysubstance use overlooks the complex nature of many SUDs and the potential for co-occurring substance involvement. This can lead to an incomplete picture of the client's challenges and hinder the development of a comprehensive treatment plan, thereby failing to meet the standard of care expected under CATC regulations. Professionals should employ a decision-making process that begins with understanding the client's presenting problem and history. This is followed by identifying potential screening tools that are evidence-based, validated for the target population, and relevant to the suspected substance use patterns. Consideration should then be given to the practicalities of administration within the treatment setting and the specific requirements of the CATC regulatory framework. Finally, the chosen tool should be administered and interpreted competently, with results integrated into a broader clinical assessment to inform treatment planning. Question 9. Strategic planning requires addiction treatment counselors to anticipate and address potential ethical and legal dilemmas. When a counselor working with an adult client develops a reasonable suspicion that the client's child is being subjected to ongoing neglect due to the client's substance use, what is the most appropriate course of action to ensure compliance with mandatory reporting requirements and uphold professional ethics? Option A. Immediately report the suspicion to Child Protective Services, documenting the specific observations and concerns, after consulting with a supervisor to confirm the reporting protocol. Option B. Discuss the suspicion with other clients in a group therapy session to gather their opinions on whether the situation warrants a report. Option C. Wait to see if the client's substance use improves and the situation resolves itself before considering any reporting action. Option D. Inform the client that their substance use is raising concerns about child neglect and that a report will be made if the situation does not improve. The correct answer is A. Immediately report the suspicion to Child Protective Services, documenting the specific observations and concerns, after consulting with a supervisor to confirm the reporting protocol. Explanation. This scenario presents a common yet complex challenge for addiction counselors, balancing client confidentiality with legal and ethical obligations to report suspected child abuse or neglect. The professional challenge lies in accurately assessing the situation, understanding the nuances of mandatory reporting laws, and acting in a manner that protects the child while respecting the client's trust and rights. Careful judgment is required to avoid both underreporting, which could endanger a child, and overreporting, which could damage the therapeutic relationship and violate client privacy unnecessarily. The correct approach represents best professional practice because it prioritizes the safety and well-being of a child, which is a paramount ethical and legal duty for addiction counselors. By consulting with a supervisor and reviewing relevant state statutes and agency policies, the counselor ensures that their actions are compliant with mandatory reporting requirements and align with ethical guidelines for professional conduct. This process of seeking guidance and verifying legal obligations demonstrates a commitment to responsible practice and protects both the client and the counselor from potential legal and ethical repercussions. An incorrect approach that involves delaying the report to gather more definitive proof before contacting authorities fails to recognize the immediacy of child protection concerns. Mandatory reporting laws typically require reporting based on reasonable suspicion, not absolute certainty. Delaying a report based on a desire for more evidence can put a child at continued risk and may constitute a violation of reporting statutes. Another incorrect approach, which is to avoid reporting altogether due to concerns about breaching client confidentiality, is a significant ethical and legal failure. While confidentiality is a cornerstone of addiction counseling, it is not absolute. Mandatory reporting laws create a legal exception to confidentiality when there is a reasonable suspicion of child abuse or neglect. Failing to report in such circumstances violates both legal mandates and ethical principles that prioritize child safety. A further incorrect approach, such as reporting the suspicion directly to the suspected abuser without involving Child Protective Services, is highly problematic. This action not only bypasses the legally mandated reporting channels, but also potentially alerts the abuser, which could lead to further harm to the child, destruction of evidence, or retaliation against the reporting counselor. It undermines the protective function of Child Protective Services and is a severe breach of professional responsibility. The professional decision-making process for similar situations should involve a clear understanding of mandatory reporting laws in the relevant jurisdiction. When a suspicion of child abuse or neglect arises, the counselor should immediately assess the information against the legal definition of reportable abuse or neglect. If the situation meets the threshold for reporting, the counselor should consult with their supervisor or a designated agency contact to discuss the case and confirm the reporting procedure. The report should then be made promptly to the appropriate Child Protective Services agency, adhering to all legal requirements regarding content and timeliness. Maintaining thorough documentation of the suspicion, the consultation, and the report made is also crucial. Question 10. Regulatory review indicates that a Certified Addictions Treatment Counselor, CAT, is developing a treatment plan for a client presenting with polysubstance use disorder and a history of trauma. The CAC is considering several psychological theories to guide their approach. Which of the following represents the most ethically and regulatorily sound strategy for selecting and applying a theoretical framework in this complex case? Option A. Focus solely on the immediate cessation of substance use, employing a highly directive, behavioral approach without deeply exploring the underlying psychological factors or the impact of trauma, as this is the most direct path to recovery. Option B. Prioritize the psychological theory that the CAC finds most intellectually stimulating or personally resonant, regardless of its direct empirical support for addiction treatment or its specific relevance to trauma-informed care. Option C. Conduct a thorough client assessment to understand the interplay of their substance use, trauma history, and individual needs, then integrate principles from multiple evidence-based psychological theories, e.g., cognitive behavioral psychodynamic attachment theory, that are known to be effective in addressing both addiction and trauma, ensuring interventions are tailored and culturally sensitive. Option D. Select a single, well-established psychological theory that broadly explains addiction, and apply its core principles consistently to all aspects of the client's treatment, assuming this will provide a comprehensive framework. The correct answer is D. Select a single, well-established psychological theory that broadly explains addiction and apply its core principles consistently to all aspects of the client's treatment, assuming this will provide a comprehensive framework. Explanation. Scenario analysis. This scenario presents a common implementation challenge for certified addictions treatment counselors, CAC, when applying psychological theories to client care. The challenge lies in selecting and applying a theoretical framework that is not only evidence-based, but also ethically sound and compliant with the specific regulatory requirements governing CAC practice within the designated jurisdiction. Counselors must navigate the nuances of different theories, considering their applicability to diverse client presentations and avoiding oversimplification or misapplication that could lead to ineffective or harmful treatment. The need for a deep understanding of both the theories themselves and the regulatory landscape is paramount. Correct approach analysis. The correct approach involves a comprehensive assessment of the client's presenting issues, history, and individual needs, followed by the selection of a psychological theory that best explains the development and maintenance of their addiction, while also aligning with the CAC scope of practice and the prevailing ethical guidelines. This approach prioritizes client-centered care, ensuring that the chosen theoretical framework informs interventions that are tailored, evidence-based, and respectful of the client's autonomy and cultural background. Regulatory compliance is inherent in this process, as ethical practice for CAC is intrinsically linked to adherence to established professional standards and legal mandates within their jurisdiction. Incorrect approaches analysis. One incorrect approach involves rigidly adhering to a single psychological theory without considering the client's unique circumstances or the potential limitations of that theory. This can lead to a one-size-fits-all treatment plan that fails to address the multifaceted nature of addiction and may violate ethical principles of individualized care. It also risks misinterpreting client behaviors through a narrow theoretical lens, potentially leading to misdiagnosis or ineffective interventions. Another incorrect approach is to prioritize theoretical elegance or personal preference over empirical evidence and client suitability. This can result in the application of theories that lack robust support for addiction treatment or are not appropriate for the client's developmental stage, cognitive abilities, or cultural context. Such an approach disregards the professional obligation to provide competent and effective care, potentially leading to client harm and regulatory sanctions. A third incorrect approach is to neglect the integration of psychological theories with practical, evidence-based interventions. While understanding theory is crucial, it must translate into actionable treatment strategies. Failing to do so means the theoretical framework remains abstract and does not benefit the client. This can be seen as a failure to meet the core responsibilities of a CATC, which include facilitating client progress towards recovery through applied therapeutic techniques informed by theoretical understanding. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough client assessment. This assessment should inform the selection of appropriate theoretical frameworks, considering their empirical support for addiction treatment and their alignment with the client's specific needs and goals. Counselors must then critically evaluate how these theories translate into practical, evidence-based interventions that are within their scope of practice and adhere to all relevant regulations and ethical codes. Continuous professional development and consultation with peers are essential to ensure the ongoing refinement of theoretical application and intervention strategies. Question 11. Market research demonstrates that clients often have strong initial ideas about their recovery journey. A certified addictions treatment counselor, CATC, is working with a new client who expresses a desire to focus exclusively on attending support group meetings and avoiding any formal counseling sessions. The client states they have found success with this approach in the past. The CATC has completed an initial assessment, which indicates the client also struggles with co-occurring mental health issues and has limited coping skills for managing triggers. Considering the CATC ethical obligations and regulatory requirements for developing individualized treatment plans, which of the following approaches best guides the counselor's next steps? Option A. Insist that the client must engage in formal counseling sessions to address their mental health issues and coping skills, as this is a non-negotiable requirement for treatment, and inform the client that support groups alone are insufficient. Option B. Develop a treatment plan that primarily consists of attending support group meetings, but also includes a few general, non-specific coping skill exercises that the client can do independently, without directly addressing the co-occurring mental health issues in detail. Option C. Discuss the client's past positive experiences with support groups while also explaining the importance of addressing their co-occurring mental health issues and developing new coping skills through integrated counseling, proposing a treatment plan that includes both elements and seeking the client's input and agreement. Option D. Immediately agree to the client's request to focus solely on support groups, as this is what the client desires and has found beneficial previously, and document this as the treatment plan. The correct answer is C. Discuss the client's past positive experiences with support groups while also explaining the importance of addressing their co-occurring mental health issues and developing new coping skills through integrated counseling, proposing a treatment plan that includes both elements and seeking the client's input and agreement. Explanation. This scenario presents a common challenge in addiction treatment, balancing client autonomy with the counselor's professional responsibility to ensure safety and efficacy in treatment planning. The counselor must navigate the client's expressed preferences and perceived readiness for change against established best practices and regulatory requirements for developing a comprehensive and individualized treatment plan. The professional challenge lies in fostering a collaborative relationship while also upholding ethical and legal obligations to provide appropriate care. The correct approach represents best professional practice because it prioritizes a collaborative, client-centered methodology that is fundamental to effective addiction counseling. Developing an individualized treatment plan requires a thorough assessment of the client's unique needs, strengths, and challenges, as well as their goals and preferences. This approach aligns with the ethical principles of respect for autonomy and beneficence, ensuring the plan is tailored to the individual and promotes their well-being. Furthermore, it adheres to the CATC regulatory framework, which mandates individualized treatment planning based on comprehensive assessment and client involvement. This ensures the plan is not only clinically sound, but also culturally sensitive, and respects the client's right to participate in decisions about their care. An incorrect approach that solely focuses on the client's immediate desires without a comprehensive assessment fails to meet the regulatory requirement for a thorough evaluation. This could lead to a superficial plan that does not address the underlying issues contributing to addiction, potentially resulting in treatment failure and harm to the client. Ethically, it violates the principle of beneficence by not providing the most effective care possible. Another incorrect approach that imposes a rigid, counselor-dictated plan without significant client input disregards the principle of autonomy and can lead to client disengagement and resistance. This approach is not only ethically problematic, but also clinically ineffective, as treatment is most successful when clients are invested and feel ownership of their recovery journey. Regulatory frameworks emphasize client participation in treatment planning. A third incorrect approach that relies solely on generalized, non-individualized protocols, even if evidence-based, fails to acknowledge the unique biopsychosocial spiritual factors influencing each client's addiction. This violates the core tenet of individualized treatment planning, which is a cornerstone of professional addiction counseling and a regulatory expectation. Such an approach risks overlooking critical needs or strengths, rendering the treatment plan less effective and potentially unethical. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a comprehensive biopsychosocial spiritual assessment. 2. Collaboratively identify client strengths, challenges, and recovery goals. 3. Integrate assessment findings with evidence-based practices and regulatory requirements. 4. Develop a treatment plan that is individualized, measurable, achievable, relevant, and time-bound. SMART. 5. Ensure the client understands and agrees to the treatment plan, fostering active participation. 6. Regularly review and revise the treatment plan based on client progress and evolving needs. Question 12. The audit findings indicate that a certified addictions treatment counselor, CAT, has primarily focused on the client's self-reported frequency and duration of substance use when developing a treatment plan, with limited exploration of other contributing elements. Which of the following approaches best reflects a comprehensive assessment of risk and protective factors for this client? Option A. Focusing exclusively on the client's legal and financial consequences of substance use as the primary motivators for treatment engagement. Option B. Relying solely on the client's self-assessment of their readiness for change, without independently verifying or exploring underlying motivations. Option C. Prioritizing interventions that address immediate withdrawal symptoms and cravings, assuming that once these are managed, other issues will naturally resolve. Option D. Systematically assessing a wide range of potential risk factors, e.g., family history, co-occurring mental health conditions, environmental stressors, and protective factors, e.g., social support, coping skills, employment stability, to inform a multidimensional treatment plan. The correct answer is D. Systematically assessing a wide range of potential risk factors, e.g., family history, co-occurring mental health conditions, environmental stressors, and protective factors, e.g., social support, coping skills, employment stability, to inform a multidimensional treatment plan. Explanation. This scenario presents a professional challenge because the audit findings highlight a potential gap in the counselor's assessment of a client's risk and protective factors, which is fundamental to effective addiction treatment planning. The challenge lies in accurately identifying and prioritizing these factors to develop a comprehensive and individualized treatment plan that addresses the client's specific vulnerabilities and strengths. Careful judgment is required to move beyond superficial observations and delve into the nuanced interplay of biological, psychological, and social determinants of addiction. The correct approach represents best professional practice because it directly aligns with the core principles of evidence-based addiction counseling and the ethical obligations to provide client-centered care. By systematically evaluating a broad spectrum of risk and protective factors, the counselor ensures that the treatment plan is not only responsive to the client's immediate needs, but also addresses underlying issues that may contribute to relapse. This comprehensive assessment is crucial for developing targeted interventions, fostering resilience, and promoting long-term recovery, as mandated by professional standards that emphasize a holistic understanding of the client's situation. An incorrect approach that focuses solely on the client's self-reported substance use history fails to acknowledge the multifaceted nature of addiction. This approach is professionally unacceptable because it neglects crucial environmental, social, and psychological risk factors, e.g., family history of addiction, co-occurring mental health disorders, lack of social support, and protective factors, e.g., stable employment, positive peer relationships, coping skills that significantly influence treatment outcomes. Such a narrow focus can lead to an incomplete or ineffective treatment plan, potentially increasing the risk of relapse and failing to meet the client's comprehensive needs. Another incorrect approach that prioritizes only immediate safety concerns without a thorough assessment of underlying risk and protective factors is also professionally unacceptable. While immediate safety is paramount, a reactive approach that doesn't explore the root causes of the risk can lead to a superficial intervention. For instance, addressing immediate withdrawal symptoms without understanding the client's social stressors or lack of coping mechanisms would be a failure to provide holistic care. This oversight can result in a treatment plan that is not sustainable once immediate crises are managed, as the underlying vulnerabilities remain unaddressed. The professional decision-making process for similar situations should involve a systematic and ongoing assessment of risk and protective factors. This process begins with a thorough intake and continues throughout treatment, adapting as the client progresses. Counselors should utilize validated assessment tools, engage in active listening, and collaborate with the client to identify both vulnerabilities and strengths. The focus should always be on developing a dynamic treatment plan that is informed by a deep understanding of the individual's unique circumstances, ensuring that interventions are tailored to promote recovery and reduce the likelihood of relapse. This aligns with the ethical imperative to provide competent and individualized care. Question 13. Implementation of treatment plan for a client from a cultural background significantly different from the counselor's own requires the counselor to consider how their personal cultural lens might influence their perception of the client's substance use, recovery goals, and family dynamics. Which of the following approaches best reflects ethical and culturally competent practice in this situation? Option A. Directly question the client about their cultural beliefs and practices, framing them as potential obstacles to recovery that need to be overcome. Option B. Gently steer the conversation away from potentially sensitive cultural topics to avoid making the client uncomfortable or revealing the counselor's own lack of familiarity. Option C. Actively seek to understand the client's cultural worldview and how it shapes their experiences with addiction and recovery, integrating this understanding into the treatment plan while respecting the client's autonomy. Option D. Apply the counselor's own cultural understanding of addiction and recovery to interpret the client's behaviors and guide their treatment, assuming shared values and norms. The correct answer is C. Actively seek to understand the client's cultural worldview and how it shapes their experiences with addiction and recovery, integrating this understanding into the treatment plan while respecting the client's autonomy. Explanation. This scenario presents a professional challenge due to the counselor's personal biases potentially impacting the therapeutic alliance and the client's progress. The counselor must navigate the ethical imperative of providing unbiased, client-centered care while acknowledging their own cultural background and its influence. Careful judgment is required to ensure that personal beliefs do not supersede professional responsibilities or negatively affect the client's well-being. The correct approach represents best professional practice because it prioritizes the client's autonomy and self-determination. By actively seeking to understand the client's cultural context and integrating that understanding into the treatment plan, the counselor demonstrates respect for the client's identity and lived experience. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as well as the specific requirements for cultural competence outlined in professional codes of conduct for addiction counselors. It fosters trust and a stronger therapeutic relationship, which are crucial for successful treatment outcomes. An incorrect approach that involves imposing the counselor's own cultural values or beliefs on the client represents a significant ethical failure. This violates the principle of client autonomy and can lead to alienation, mistrust, and a breakdown of the therapeutic relationship. It also demonstrates a lack of cultural competence, failing to recognize and respect the diversity of human experience. Such an approach could be seen as discriminatory and harmful, potentially leading to a negative treatment experience and exacerbating the client's issues. Another incorrect approach, that of avoiding any discussion of cultural differences due to discomfort, is also professionally unacceptable. This avoidance can be interpreted by the client as a lack of interest or an inability to engage with their full identity, hindering the development of a genuine therapeutic alliance. It fails to address potential cultural barriers to treatment and misses opportunities to build rapport and tailor interventions effectively. This passive approach does not uphold the counselor's responsibility to provide comprehensive and culturally sensitive care. A further incorrect approach, that of assuming all clients from a particular cultural group share the same beliefs and experiences, is a form of stereotyping. This generalization is a direct contravention of cultural competence, which requires individualizing care and recognizing the unique experiences of each client, even within shared cultural backgrounds. It can lead to misinterpretations, inappropriate interventions, and a failure to address the client's specific needs and concerns. A professional decision-making process for similar situations should involve self-reflection on personal biases, a commitment to ongoing cultural humility and education, and a client-centered approach that prioritizes active listening and open communication. Counselors should be prepared to explore cultural factors with clients in a sensitive and respectful manner, adapting their interventions to align with the client's cultural framework and values, always with the goal of enhancing treatment efficacy and promoting the client's well-being. Question 14. The control framework reveals that a client presents with a history of polysubstance use and is exhibiting symptoms of significant anxiety, paranoia, and mood lability. While these symptoms could be related to acute intoxication or withdrawal, the client also reports a long-standing history of these experiences predating their current substance use. As a certified addictions treatment counselor, CATC, what is the most appropriate course of action to ensure comprehensive and ethical care? Option A. Advise the client that their mental health symptoms are likely a result of their substance use and encourage them to focus solely on sobriety, suggesting they will address mental health concerns after a significant period of abstinence. Option B. Focus exclusively on the substance use disorder treatment, assuming the client's mental health symptoms are solely a consequence of their addiction and will resolve with abstinence. Option C. Attempt to manage the client's anxiety and paranoia using only basic counseling techniques and educational materials related to substance use, without seeking further professional input for the mental health symptoms. Option D. Initiate a comprehensive assessment for co-occurring disorders, including a referral to a qualified mental health professional for a diagnostic evaluation, and develop an integrated treatment plan addressing both the substance use disorder and the suspected mental health condition. The correct answer is D. Initiate a comprehensive assessment for co-occurring disorders, including a referral to a qualified mental health professional for a diagnostic evaluation, and develop an integrated treatment plan addressing both the substance use disorder and the suspected mental health condition. Explanation. This scenario presents a common challenge in addiction treatment: the complex interplay of co-occurring mental health disorders. A professional's responsibility is to provide integrated care that addresses both the substance use disorder and the suspected mental health condition. This requires a thorough assessment, understanding of diagnostic criteria, and the ability to differentiate symptoms that may be exacerbated by substance use versus those indicative of a primary mental health disorder. The challenge lies in avoiding premature diagnostic conclusions, ensuring client safety, and adhering to ethical guidelines regarding competence and scope of practice. The correct approach emphasizes a comprehensive, integrated assessment process. This aligns with best practices in co-occurring disorders treatment, which advocate for a holistic view of the client. By collaborating with a qualified mental health professional, the counselor ensures that the client receives an accurate diagnosis and appropriate treatment for both conditions. This approach respects the client's dignity, promotes recovery, and adheres to ethical principles of seeking consultation and referral when expertise is needed, as often mandated by professional codes of conduct and regulatory bodies governing addiction counselors. An incorrect approach that focuses solely on the substance use disorder without acknowledging or investigating the potential co-occurring mental health issue fails to meet the client's comprehensive needs. This can lead to incomplete treatment, relapse, and a worsening of both conditions. Ethically, it represents a failure to provide adequate care and potentially a violation of professional standards that require addressing all presenting problems. Another incorrect approach, which involves self-diagnosing and treating the suspected mental health disorder without appropriate qualifications or consultation, is a significant ethical and regulatory breach. Addiction counselors typically operate within a defined scope of practice. Attempting to treat a mental health disorder without proper licensure or supervision can lead to misdiagnosis, ineffective treatment, and harm to the client. This violates principles of competence and may contraindicate specific licensing board regulations. Finally, an approach that dismisses the client's reported symptoms as solely related to substance withdrawal or intoxication without further investigation is also professionally unsound. While substance use can mimic or exacerbate mental health symptoms, it is crucial to conduct a thorough differential diagnosis. Ignoring potential co-occurring disorders can lead to missed opportunities for effective treatment and can negatively impact long-term recovery outcomes. The professional decision-making process in such situations should involve 1. Recognizing and acknowledging all presenting symptoms, including those suggestive of mental health issues. 2. Conducting a thorough biopsychosocial assessment that specifically screens for co-occurring disorders. 3. Consulting with supervisors or peers when uncertainty exists. 4. Collaborating with other professionals, such as mental health clinicians, for accurate diagnosis and integrated treatment planning. 5. Adhering strictly to the counselor's scope of practice and ethical guidelines regarding referrals and competence. Question 15. Operational review demonstrates that a new client who has previously undergone addiction treatment expresses a strong desire to begin therapy immediately and states, "I know how this works, just get me started." The counselor is aware that the standard informed consent process involves a detailed discussion of treatment goals, potential risks and benefits, confidentiality limits, and alternative treatment options. What is the most ethically and regulatorily sound approach for the counselor to take in this situation, adhering strictly to CATC requirements? Option A. Proceed with the detailed informed consent process, explaining all elements clearly and allowing ample time for questions, even if it delays the start of therapy. Option B. Provide the client with the written consent form to read and sign, assuming they understand the implications based on their previous treatment. Option C. Briefly summarize the key aspects of the treatment and have the client sign the consent form, acknowledging their prior experience. Option D. Begin therapy immediately to address the client's immediate distress and discuss informed consent later when the client is more settled. Correct answer is A. Proceed with the detailed informed consent process, explaining all elements clearly and allowing ample time for questions, even if it delays the start of therapy. Explanation. This scenario is professionally challenging because it requires balancing the client's immediate perceived need for information with the ethical and regulatory obligation to ensure truly informed consent. The counselor must navigate the client's potential distress and desire for quick answers while upholding the integrity of the consent process, which is foundational to ethical and legal practice in addiction treatment. The correct approach represents best professional practice because it prioritizes the client's autonomy and understanding by taking the time to explain the risks, benefits, and alternatives in a clear, understandable manner, and ensuring the client has the opportunity to ask questions and comprehend the information before agreeing to treatment. The counselor adheres to the core principles of informed consent as mandated by the CATC regulatory framework. This process ensures the client's decision is voluntary and based on a genuine understanding of what they are agreeing to, thereby protecting both the client and the counselor. An incorrect approach that rushes through the consent process, assuming the client understands due to prior experience or a stated desire to proceed quickly, fails to meet the regulatory requirements for informed consent. This failure constitutes a significant ethical breach, as it undermines the client's right to make an autonomous decision. Specifically, it violates the principle of ensuring comprehension, which is a critical component of informed consent. The client may agree to treatment without fully grasping potential side effects, limitations of confidentiality, or alternative treatment options, leading to potential harm or dissatisfaction. Another incorrect approach that involves providing only a brief overview without allowing for questions or addressing specific concerns neglects the interactive nature of informed consent. This is a regulatory failure because informed consent is not a one-way delivery of information, but a dialogue. By not actively soliciting and addressing the client's questions, the counselor fails to ensure the client's unique concerns are addressed, which is essential for a truly informed decision. A third incorrect approach that relies solely on a written consent form without verbal explanation or confirmation of understanding is also a regulatory and ethical failure. While written consent is necessary, it is often insufficient on its own, especially for individuals who may have difficulty reading, comprehending complex language, or are experiencing acute distress. The CATC framework emphasizes clear communication and understanding, which a written document alone may not guarantee. The professional decision-making process for similar situations should involve a systematic approach. First, assess the client's current state and capacity to understand. Second, identify the essential elements of informed consent relevant to the specific treatment being offered. Third, present this information in a clear, jargon-free manner, tailored to the client's literacy and comprehension level. Fourth, actively encourage and respond to questions. Fifth, document the consent process thoroughly, including any discussions about risks, benefits, alternatives, and the client's understanding. And finally, ensure the client has ample opportunity to consider the information before providing consent. Question 16. Cost-benefit analysis shows that a client-centered approach to addiction treatment, which actively identifies and integrates a client's existing strengths and resources into the treatment plan, leads to better long-term outcomes. Considering this, which of the following best reflects the integration of client strengths and resources in a CAC practice? Option A. Collaboratively exploring the client's past successes, personal values, and existing social support networks to inform treatment goals and interventions, ensuring the client feels empowered and capable. Option B. Primarily focusing on the client's deficits and developing a comprehensive list of professional interventions to address each identified problem area. Option C. Relying solely on external support services and professional guidance to manage the client's recovery, without significant exploration of the client's internal coping mechanisms or informal support. Option D. Developing a treatment plan based on standardized protocols for addiction, assuming all clients with similar diagnoses will benefit from the same set of interventions. The correct answer is A. Collaboratively exploring the client's past successes, personal values, and existing social support networks to inform treatment goals and interventions, ensuring the client feels empowered and capable. Explanation. This scenario presents a common challenge in addiction treatment, balancing the immediate need for intervention with the long-term goal of fostering client autonomy and resilience. The professional challenge lies in identifying and leveraging a client's existing strengths and resources, which are often overlooked when focusing solely on deficits and pathology. Effective integration of these assets can significantly enhance treatment engagement, reduce relapse rates, and promote sustainable recovery. The correct approach represents best professional practice because it aligns with the core ethical principles of client-centered care and empowerment, as mandated by CAC regulatory frameworks. Specifically, it emphasizes a collaborative treatment planning process where the counselor actively seeks to understand and build upon the client's inherent capabilities, support systems, and past successes. This approach respects client dignity and promotes self-efficacy, which are crucial for long-term recovery and adherence to treatment. It also aligns with the principle of do no harm by avoiding the potential for disempowerment that can arise from an overly deficit-focused model. An incorrect approach that solely focuses on identifying deficits and developing interventions without acknowledging or integrating existing strengths is professionally unacceptable. This failure can lead to a treatment plan that feels imposed rather than collaborative, potentially alienating the client and undermining their motivation. Ethically, it can be seen as a failure to provide comprehensive and individualized care, as it neglects a significant aspect of the client's well-being and recovery potential. Furthermore, it may violate guidelines that promote client self-determination and the development of coping mechanisms that draw from the client's own experiences and resources. Another incorrect approach that relies exclusively on external resources and professional interventions without exploring the client's internal strengths or existing informal support networks is also professionally unsound. This can create dependency on the treatment system and fail to equip the client with the skills and confidence to manage their recovery independently once formal treatment concludes. Regulatory frameworks often emphasize the development of sustainable recovery strategies, which inherently involve mobilizing a client's personal and social capital. The professional decision-making process for similar situations should involve a thorough assessment that goes beyond identifying substance use patterns and co-occurring disorders. It requires actively probing for evidence of resilience, past coping strategies that were successful even if not in the context of addiction, personal values, interests, and existing social support systems. This information should then be explicitly integrated into the treatment plan, with the client's active participation and agreement to ensure that interventions are not only addressing problems, but also building upon and reinforcing the client's inherent capacity for recovery. Question 17. Investigation of a client's persistent relapse, characterized by returning to substance use immediately following periods of abstinence, particularly when encountering specific social situations and emotional states previously associated with substance use, prompts a CAC to consider various intervention strategies. Which behavioral model-informed approach would be most appropriate for addressing this pattern? Option A, suggesting that the client's relapse is a sign of inherent weakness and that further treatment is unlikely to be effective due to a lack of intrinsic motivation. Option B, recommending immediate and complete abstinence from all mood-altering substances without exploring the underlying behavioral patterns or triggers that contribute to relapse. Option C, implementing a treatment plan that focuses on identifying and modifying the environmental cues and learned associations that trigger substance use, alongside developing alternative coping mechanisms for high-risk situations. Option D, counseling the client on the importance of stronger willpower and personal resolve to overcome the desire for substances, emphasizing moral fortitude. The correct answer is C, implementing a treatment plan that focuses on identifying and modifying the environmental cues and learned associations that trigger substance use, alongside developing alternative coping mechanisms for high-risk situations. Explanation. This scenario presents a common implementation challenge for a certified addictions treatment counselor, CAC, when working with a client who exhibits behaviors consistent with a learned response to environmental cues, a concept central to behavioral models of addiction. The challenge lies in selecting the most effective intervention strategy based on the client's presentation and the underlying theoretical framework. Careful judgment is required to avoid misinterpreting the client's actions and applying an inappropriate or ineffective treatment approach, which could hinder progress and potentially violate ethical standards of care. The correct approach represents best professional practice because it directly addresses the client's learned associations and environmental triggers, aligning with the principles of behavioral models. By focusing on identifying and modifying these learned responses, the CAC utilizes evidence-based techniques that are specifically designed to address the behavioral components of addiction. This aligns with the CAC ethical obligation to provide competent and effective treatment based on recognized professional standards and the client's specific needs. The regulatory framework for CAC emphasizes the use of evidence-based practices and client-centered care, which this approach embodies. An incorrect approach that focuses solely on the client's lack of willpower or moral failing would be professionally unacceptable. This would represent a significant ethical failure by stigmatizing the client and failing to acknowledge the complex biopsychosocial nature of addiction, particularly the learned behavioral components. Such an approach would violate the CAC duty to provide non-judgmental and respectful care and would be contrary to the understanding of addiction as a treatable condition. Furthermore, it would disregard the established behavioral models that highlight the role of conditioning and reinforcement in maintaining addictive behaviors. Another incorrect approach that solely emphasizes immediate abstinence without addressing the underlying behavioral patterns and triggers would also be professionally problematic. While abstinence is often a goal, purely abstinence-only approach without considering the behavioral mechanisms that lead to relapse can be ineffective and may not equip the client with the necessary coping skills. This could lead to frustration and a sense of failure for the client, potentially undermining the therapeutic relationship and the overall treatment process. It fails to fully leverage the insights provided by behavioral models regarding the environmental and learned aspects of addiction. The professional decision-making process for similar situations should involve a thorough assessment of the client's presenting problems, including their behavioral patterns, triggers, and the environmental factors that may be contributing to their addiction. The CAC should then consider which theoretical models of addiction best explain the client's behavior. Based on this understanding, the CAC can select interventions that are evidence-based and aligned with the chosen theoretical framework. This process requires ongoing evaluation of the client's progress and flexibility in adjusting the treatment plan as needed, always prioritizing the client's well-being and adhering to ethical and regulatory guidelines. Question 18. What factors determine the extent and nature of family involvement in an individual's addiction treatment planning, ensuring optimization of therapeutic outcomes while adhering to client confidentiality and autonomy. Option A. The counselor's professional judgment regarding the family's perceived stability and willingness to comply with treatment recommendations, regardless of client consent. Option B. The perceived severity of the client's addiction and the family's expressed desire to be involved in the treatment process. Option C. The client's explicit, informed consent and assessed readiness for family participation, alongside a professional evaluation of potential therapeutic benefits and risks to the client's recovery. Option D. The availability of family members and their ability to contribute financially to the treatment program. Correct answer is C. The client's explicit, informed consent and assessed readiness for family participation, alongside a professional evaluation of potential therapeutic benefits and risks to the client's recovery. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the client's autonomy and confidentiality with the potential benefits of family involvement in addiction treatment. Counselors must navigate complex family dynamics, potential resistance from family members or the client, and ensure that any involvement is therapeutic and respects the client's privacy rights as mandated by relevant regulations. The goal is to optimize treatment outcomes by leveraging supportive relationships without compromising the client's trust or legal protections. Correct approach analysis. The correct approach prioritizes a client-centered, consent-driven process that aligns with ethical guidelines and regulatory frameworks governing addiction treatment. This involves a thorough assessment of the client's readiness and willingness to involve family, understanding the potential benefits and risks, and obtaining explicit, informed consent. This approach upholds client autonomy, respects confidentiality, and ensures that family involvement is a therapeutic tool, not a mandate, thereby optimizing the treatment plan for the client's specific needs and circumstances. This aligns with the principles of client self-determination and the ethical duty to protect client information. Incorrect approaches analysis. One incorrect approach would be to automatically include family members in treatment planning without assessing the client's consent or readiness. This violates the client's right to confidentiality and autonomy, potentially alienating the client and undermining the therapeutic alliance. It disregards the principle that treatment is client-driven and that family involvement must be a consensual and beneficial addition. Another incorrect approach would be to exclude family entirely, even when the client expresses a desire for their involvement, and it could be therapeutically beneficial. This limits the potential for a robust support system and misses an opportunity to address family dynamics that may be contributing to or impacted by the addiction. It fails to optimize the treatment plan by neglecting a potentially valuable resource. A third incorrect approach would be to prioritize family wishes over the client's expressed needs and goals in the treatment plan. This undermines the client's agency and can lead to resentment and noncompliance. The treatment plan must be centered on the client's recovery journey, with family involvement serving as a supportive element, not a directive one. This approach fails to adhere to the fundamental principle of client-centered care. Professional reasoning. Professionals should employ a decision-making process that begins with a comprehensive assessment of the client's situation, including their readiness for family involvement and potential benefits. This assessment should be followed by open communication with the client about their preferences and concerns. Obtaining explicit, informed consent is paramount before any family engagement. The counselor must then collaboratively develop a treatment plan that integrates family support in a way that is therapeutic, respects boundaries, and aligns with the client's recovery goals, all while adhering to strict confidentiality and privacy regulations. Question 19. When evaluating a client presenting with symptoms suggestive of an alcohol use disorder (AUD) and exhibiting signs of anxiety, what is the most appropriate initial step for a certified addictions treatment counselor (CATC) to take to ensure regulatory compliance and best professional practice? Option A. Administer a standardized, evidence-based assessment tool for AUD and a co-occurring mental health screening to gather comprehensive diagnostic information. Option B. Immediately refer the client for inpatient detoxification services based on the initial presentation of potential AUD symptoms. Option C. Focus solely on the AUD symptoms, deferring any assessment of anxiety until the alcohol-related issues are stabilized. Option D. Rely on clinical intuition and past experience to formulate an initial diagnosis and treatment plan for the AUD. The correct answer is A. Administer a standardized, evidence-based assessment tool for AUD and a co-occurring mental health screening to gather comprehensive diagnostic information. Explanation. This scenario presents a common challenge in addiction counseling, balancing the immediate need for intervention with the client's autonomy and the legal/ethical requirements for informed consent and appropriate assessment. The professional must navigate the complexities of a client presenting with potential alcohol use disorder (AUD), while also exhibiting signs of co-occurring mental health issues, which can complicate diagnosis and treatment planning. The urgency of addressing potential AUD must be weighed against the need for a comprehensive evaluation that accounts for all presenting problems. The correct approach represents best professional practice because it prioritizes a thorough, client-centered assessment that adheres to established diagnostic criteria and ethical guidelines for substance use disorder treatment. This involves utilizing validated assessment tools and considering the full spectrum of the client's symptoms, including any co-occurring mental health conditions, as mandated by professional standards and regulatory frameworks governing addiction counseling. This comprehensive approach ensures that the treatment plan is tailored to the individual's unique needs, promoting effective recovery and minimizing the risk of misdiagnosis or inappropriate treatment. An incorrect approach that focuses solely on immediate detoxification without a full assessment fails to meet the ethical obligation to provide a complete and accurate diagnosis. This can lead to ineffective treatment, potential harm to the client, and a violation of professional standards that require a comprehensive evaluation before initiating treatment. Another incorrect approach that relies on anecdotal evidence or personal bias rather than standardized assessment tools disregards the scientific basis of addiction treatment and the regulatory requirement for evidence-based practices. This can result in misjudgment, inadequate care, and a failure to meet the client's actual needs, potentially leading to negative outcomes and professional repercussions. An approach that bypasses the client's consent for specific assessments or interventions, even with good intentions, violates fundamental ethical principles of autonomy and informed consent, which are critical components of regulatory compliance in healthcare. Professionals should employ a decision-making process that begins with recognizing the presenting problem and its potential severity. This is followed by an immediate commitment to a comprehensive assessment that utilizes appropriate, validated tools and considers all co-occurring conditions. Throughout this process, maintaining open communication with the client, obtaining informed consent for all evaluative and therapeutic steps, and adhering strictly to the established ethical codes and regulatory guidelines for addiction counselors are paramount. This systematic approach ensures that interventions are both effective and ethically sound. Question 20. The performance metrics show that a client has stated their primary goal as to feel better and get my life back on track. As a certified addictions treatment counselor (CAT), what is the most appropriate next step to ensure effective goal setting and measurable outcomes within the regulatory framework? Option A. Document the client's stated goal as is, assuming that feeling better is a subjective but sufficient indicator of progress. Option B. Collaboratively work with the client to break down feeling better and getting life back on track into specific, observable, and time-bound objectives that can be tracked. Option C. Focus solely on reducing or eliminating substance use as the primary measurable outcome, as this is the most critical indicator of recovery. Option D. Immediately define a set of standard recovery goals, such as abstinence and regular attendance at support groups, and present them to the client for agreement. The correct answer is B. Collaboratively work with the client to break down feeling better and getting life back on track into specific, observable, and time-bound objectives that can be tracked. Explanation. Scenario analysis. This scenario presents a common challenge in addiction treatment. A client's stated goals appear vague and lack clear indicators of progress. The professional challenge lies in translating subjective client aspirations into concrete, measurable objectives that align with treatment efficacy and regulatory expectations for documentation and progress tracking. Without measurable outcomes, it is difficult to demonstrate treatment effectiveness, justify continued services, or adapt the treatment plan effectively. This requires a delicate balance between respecting client autonomy and ensuring adherence to professional standards and ethical obligations for client care. Correct approach analysis. The most effective approach involves a collaborative process of refining the client's broad goal into specific, measurable, achievable, relevant, and time-bound, SMART objectives. This aligns with best practices in case management and treatment planning, emphasizing client-centered care while ensuring accountability. Regulatory frameworks for addiction treatment counselors often mandate the development of individualized treatment plans with clearly defined goals and objectives that allow for ongoing assessment of progress. This method ensures that both the counselor and the client have a shared understanding of what constitutes success and how it will be measured, facilitating objective evaluation and informed adjustments to the treatment plan. This directly supports the ethical obligation to provide competent and effective care. Incorrect approaches analysis. One incorrect approach involves accepting the client's vague goal without further exploration. This fails to meet the regulatory requirement for developing a comprehensive and actionable treatment plan. Ethically, it represents a lapse in professional responsibility, as it does not adequately define the scope or expected outcomes of treatment, potentially leading to ineffective interventions and a lack of demonstrable progress. Another incorrect approach is to impose specific, externally defined goals on the client without their input or agreement. This violates the principle of client autonomy and self-determination, which are fundamental ethical considerations in counseling. It also fails to create a truly collaborative treatment plan, which is often a regulatory expectation, and can lead to client disengagement and resistance. A third incorrect approach is to focus solely on abstinence as the sole measure of success, disregarding other potential indicators of improved functioning and well-being. While abstinence may be a primary goal for many, addiction recovery is multifaceted. Focusing exclusively on this single metric can overlook significant progress in areas such as improved relationships, employment stability, or reduced engagement in risky behaviors, which are also crucial indicators of successful treatment and are often part of comprehensive treatment plan objectives. This narrow focus may not align with the client's broader recovery aspirations and can lead to a misrepresentation of treatment outcomes. Professional reasoning. When faced with vague client goals, a professional decision-making process should prioritize client engagement and collaboration. The first step is to actively listen and explore the client's underlying desires and motivations behind their stated goal. This is followed by a guided process of breaking down the broad goal into smaller, actionable steps. The counselor should then work with the client to define how progress towards these steps will be observed and documented, ensuring that the outcomes are observable and quantifiable. This iterative process ensures that the treatment plan is both client-driven and clinically sound, meeting both ethical and regulatory demands for effective addiction treatment.